KLAS in Session, where we are turning provider voices into value in healthcare IT. I'm your host, Mac Boyter, Research Director at KLAS Research. Make sure you subscribe so you don't miss any future sessions, especially as we explore one of the most rapidly evolving areas in healthcare IT, which is ambient speech technology. In today's session, we're taking a deep dive into the 2024 Ambient Speech report. I'll be covering the high-energy market landscape, the influence of EHR integration, and what's driving purchasing decisions. If you're part of a healthcare delivery organization who's trying to understand where ambient speech fits into your strategy, or a healthcare IT vendor who's looking to better support your customers, this episode is for you. Or if you know someone that could benefit from our insights, please share this with them. You can follow along by scanning the QR code in the show notes to access the full report, as well as upcoming KLAS events and collaborations. Let's get into it. So our 2024 Ambient Speech Market Report covered decision insights. At KLAS, decision insights are any information that we have on provider organizations, either selecting organizations and vendors they want to engage with and service firms, or those that they're considering selecting. And just as importantly, it also shows those who are considering moving away from certain vendor organizations or service firms. So in that report, we actually went over, from a broad level, the movement of adoption, why people are adopting certain solutions versus others. One of the major findings that we came across was the idea that healthcare systems are looking for anyone to help, any hand to hold, that can help solve for the clinician burnout crisis that's been endemic since the pandemic. During the COVID-19 pandemic, we obviously all lived through that process, and healthcare workers and physicians, clinicians specifically, really dealt with a tremendous amount of problems. Those problems were not just limited to cognitive burnout and other issues, but even personal life and other clinical issues that are really going to affect them in their personal life, but also in their home life and things like that. So one of the things we were looking at was to assess why people are selecting certain solutions. And again, our data showed that the purpose of selecting an ambient solution, although it was, again, ostensibly to decrease clinician burnout and cognitive load, also had other effects and other interesting knock-on effects. So for example, we found that patients actually valued the opportunity to speak with their clinician, maybe for the first time. Oftentimes, and all of us have been patients at one point or another, if you've been to a doctor's office, after filling out myriad forms and clipboards and other things, you'd sit down with your physician and she might start by asking what brought you in today and going through kind of an evaluation process. But ambient technology doesn't just capture what's going on in that conversation. It also brings in contextual information, prior history, orders, medications the patient might be on. And by having that information ready before the visit and during the visit, it helps provide context to that conversation. And here again is the interesting part. As patients, as we spoke with our provider friends and health systems, they talked about patient satisfaction increasing because the physician was looking at them in the eyes. They were talking to them, not just typing and inputting data on a laptop or a keyboard. By being able to do that, it actually empowers the physician, but it elevates the patient experience and helps them see why they're being prescribed the medication they're being prescribed, or why they were told they needed that MRI. It allows them to be a part of that patient care by taking ownership of their own care. One of the other interesting aspects of ambient technology or benefits through generative AI is a reductive note. Again, this is a patient-facing process. So as you have that conversation with your clinician, then after the visit is done, you receive via email typically instructions, why you're being given that medication, when you should take it, the follow-ups, when you should be seen again. All of this information that we normally would get, but here's the kicker. It's in your own language. It's in a reading style and vernacular that most people, like me, at a fourth grade reading level would actually be able to appreciate. And so this is one of those ways that generative AI and technology can actually be leveraged to improve not just the clinician experience, but the patient experience as well. One of the other findings that we had in our report was talking about why, again, health systems were selecting certain vendors for their partnership. A lot of this had to do, for example, with Microsoft DAX Copilot, now Dragon Copilot, and a Bridge because of the Epic Workshop integration and partnership. By working with Epic, we were able to see the workflow improvements, we were able to see operational efficiencies and gains. And what's interesting about that is we saw that even for those that were outside of the workshop process, so vendors like Suki and Ambience Healthcare, Nabla, DeepScribe, and others, These teams, even though they may not be in the Epic workshop, they are in the Epic toolbox or other aspects of what's called the Epic showroom. So they're being selected not just because of that integration workflow, but the direct combination of the Epic instance. Now, what about teams outside of Epic? Oracle Health, for example, or Meditech, Athena customers. We found that all of these ambient solutions were either directly integrated or had API and integration through other processes. Only rarely do we see copy-paste, where a workflow might be separate from the actual EHR, and the clinician would have to copy-paste the content into the EHR or the record note. But where we did see those issues crop up, we saw satisfaction decrease significantly. Integration, cost, those are the two major drivers for adoption or disadoption of ambient solutions. One of the other major drivers of adoption or disadoption, according to our reporting, is cost. Healthcare systems today are feeling inordinate amounts of pressure, particularly with CMS regulations and updates, new governmental initiatives, but also from the payers. And as a consequence of those budget shortfalls, they're looking, yes, for the right hand to hold in terms of a vendor partner, but they're also looking for one who can do it at a cost-effective or in a cost-effective way. So one of the things that we found, it wasn't necessarily even about the cost. It was a value proposition, a cost to yield. What is the ROI? What's the work RVU increases? Where are we seeing impacts in terms of additional patient visits? And by the way, I should note, in every instance where we saw a health system mandate that clinicians see more patients, we saw a direct correlation or inverse correlation in terms of clinician satisfaction. So by not mandating that clinicians, physicians should see more patients, yet at the same time providing the optionality, we did see certain physicians actually take on more patients voluntarily and of their own volition. This reported higher satisfaction, more remuneration, and still delivered patient care at a qualitative rate. So these are some of the reasons why we saw in our reporting why people are adopting or disadopting, moving away from certain solutions. We look forward to our research in the future to have a lot more granularity on these topics, and we're excited to share them with you. Well, that's it for today's session. We've covered the big picture view of ambient speech in healthcare, including where the market stands to the trends shaping investment decisions. To go deeper, check out the full Ambient Speech 2024 report using the QR code in the description. And please don't forget to subscribe to KLAS in session so you'll be notified when our next episode drops. We'll be exploring next time how vendors are differentiating themselves in this space.